Good morning. Have you ever taken your blood pressure at home and seen scary numbers that didn't match how you felt? Maybe 160/90 when you expected 120/80. Or bouncing readings that change every single time you press the button, 140, then 130, then 155, leaving you confused and worried. Here's the thing most men over 60 don't realize. The problem might not be your heart. It might be how the monitor is being used. Today, we're walking through the most common home blood pressure monitor mistakes men over 60 make and exactly how to fix them, so the numbers you see on that screen finally tell you the truth instead of scaring you or giving you false reassurance when you actually need help. If this sounds familiar, go ahead and like this video, drop a comment with your age and country so I know who's watching, and subscribe for the senior health guidance we share on this channel. Let's talk about why accurate blood pressure readings matter so much after 60. These numbers guide real decisions. Your doctor uses them to decide whether you need medication, whether your current dose is working, whether your risk of stroke or heart attack is climbing, and whether the lifestyle changes you're making are enough or not. Bad technique can make normal pressure look dangerously high, leading to unnecessary worry, extra pills you don't need, and side effects that could have been avoided. Just as dangerous, bad technique can make high pressure look normal, giving you false reassurance while silent damage is happening to your heart, brain, kidneys, and blood vessels. That's why learning to measure correctly isn't being fussy. It's being smart. Let's start with what happens in the 30 minutes before you take a reading. Most men don't realize that drinking coffee, tea, or an energy drink can temporarily push blood pressure up by 10 or 15 points. Same with smoking a cigarette or having a heavy meal. If you've just finished brisk activity, walking up the stairs, carrying groceries, doing yard work, your pressure is still elevated from the effort. Picture the man who climbs the stairs to the bedroom, sits down immediately on the edge of the bed, straps on the cuff while he's still catching his breath, and presses start. That reading is guaranteed to be higher than his true resting pressure. It's not wrong in the sense that his pressure really was that high in that moment, but it's not the number his doctor needs to see. The fix is simple, but requires a little patience. Finish the walk. Sit down in a quiet room. Let your heart settle for about half an hour without caffeine, nicotine, or heavy exertion. Then measure. That's the number that reflects your baseline. Now let's talk about body position, because this is where most mistakes happen. Picture the typical scene. A man sits on the edge of the bed with his legs dangling, maybe crossed at the knee. His back is unsupported. His arm is hanging in the air or resting awkwardly on his lap. The cuff is strapped over his shirt sleeve because it's easier. He's chatting with his wife or watching TV while the machine runs. Every single one of those details can throw the reading off. Crossed legs can push systolic pressure up by several points because it changes blood flow and muscle tension. An unsupported arm, whether it's dangling or held up in the air, changes the pressure gradient between the heart and the cuff, making the reading falsely high or falsely low, depending on where the arm is. Clothing under the cuff can add bulk and compression, skewing the result. And talking, or even just listening and nodding during a conversation, raises blood pressure measurably because it activates the nervous system. Here's what the corrected picture looks like. Sit in a proper chair with your back fully supported against the backrest. Both feet should be flat on the floor, not crossed, not tucked under the chair, not dangling. Rest your arm on a table or armrest, so the middle of the cuff sits at about heart level, not up by your shoulder, not down by your waist, but level with the midpoint of your chest. The cuff should be on bare skin, not over a shirt or sweater. And for the few minutes before and during the reading, stay quiet and still. No talking, no TV, No scrolling through your phone. Just sit, breathe normally, and let the machine do its work. That small shift in setup can change your reading by 10, 15, even 20 points. And suddenly the numbers make sense. Let's talk about the cuff itself, because this is another place where men run into trouble without realizing it. The cuff is like a shoe. If it's too small, it squeezes harder than it should and gives you falsely high numbers. If it's too big and loose, it can underestimate your pressure. Most cuffs have a range printed right on the fabric, something like 9 to 13 inches or 13 to 17 inches. Take a moment to actually measure your upper arm and check whether your arm size fits that range. Don't try to cram a big arm into a cuff that's clearly too small. If you need a larger cuff, get one. It's worth it for accuracy. Also, know that upper arm cuffs are generally more reliable than wrist devices, especially for older men. Wrist monitors can be convenient, but they're much more sensitive to position. Even a tiny change in how you hold your hand, a few inches up or down, can throw the reading off by a lot. Unless your doctor has specifically told you to use a wrist monitor because an upper arm cuff won't work for some reason, stick with the arm. Before you press start, give yourself about 5 minutes of quiet rest. This is the part most men skip because they're in a hurry or they don't think it matters. But it does. Sitting down and taking a reading immediately means your heart hasn't had time to settle. Your nervous system is still a little revved up. That first reading is almost always the highest. Instead, sit down, get comfortable, rest your arm, breathe slowly, and just be still for a few minutes. Let your body calm down. Then take the reading. You'll notice the difference. Here's another thing many men don't know. It's smart to take more than one reading. The first reading after you sit down, even if you've rested, is often higher than the second or third. So take a reading, wait a minute or two, and then take another. Sometimes a third. Watch the pattern. Often the numbers settle lower as your body relaxes further. Record the average of those calm readings instead of panicking over the single highest one. That average is a much better reflection of your true pressure. Let me walk you through what your next reading should look like, not as a list, but as a story. Before you sit down, empty your bladder. A full bladder can add several points to your pressure, and most men don't realize that. Choose a proper chair in a quiet room, not the edge of the bed or a stool. Sit with your back supported and both feet flat on the floor, uncrossed. Roll up your sleeve or take off your shirt so the cuff goes on bare skin. Wrap the cuff snugly around your upper arm with the bottom edge about 1 inch above your elbow and the tube running down the center of your arm, not off to the side. Rest that arm on a table or armrest so the cuff sits at about heart level. Then just sit quietly for a few minutes. Don't talk. Don't check your phone. Just breathe and relax. When you're ready, press start and stay completely still while the cuff inflates and deflates. Don't move. Don't talk. Don't hold your breath. Just let it happen. When it beeps and shows the result, write it down. Wait a minute or two and then take a second reading the same way. If the two are close, you're done. If they're far apart, take a third and look at the pattern. That's how you get a number you can actually trust. Now let's talk about the device itself. Not all monitors are created equal. Some older models drift out of calibration over time. Some cheaper models were never very accurate to begin with. Every year or two, it's smart to bring your home monitor to a clinic visit, take a reading with your device, and then have the nurse or doctor take one with their equipment right after. Compare the numbers. If your monitor consistently reads 10 or 15 points higher or lower than the office device, you know it's off and you can adjust for that or replace it. Also, check the basics regularly. Make sure the batteries are fresh. Make sure the tube isn't kinked or cracked. Follow the user manual on which arm to use, which side of the cuff should face up, and which button sequence to press. These small details matter. Here's an important safety note. If you ever get a very high reading, something like 180 over 110 or higher, and you also have symptoms like chest pain, shortness of breath, severe headache, confusion or weakness on one side of your body, that is an emergency. Do not sit there taking repeated readings, trying to get a better number. Call for help immediately. Don't wait. Don't assume it's a mistake. On the other hand, if you get one high reading but feel completely fine, don't panic. Sit quietly, wait a few minutes, and take it again using proper technique. If the second and third readings are much lower and you feel normal, the first one was likely a fluke from bad technique or timing. But never change, double, or stop your blood pressure medicine based solely on home readings without talking to your doctor first. These numbers are tools for conversation, not instructions to treat yourself. Let me answer some questions that come up often. First, does it matter which arm you use? Generally, doctors recommend checking the same arm each time for consistency, usually the left, but it's normal for one arm to read a few points different from the other. If you've never compared, try taking readings on both arms during one session and see if there's a big difference. If one arm is consistently much higher, mention that to your doctor. Second, how often should you check at home? For most men, once or twice a week is plenty unless your doctor has asked you to check more often because they're adjusting medication. Checking multiple times a day every day can become obsessive and stressful, and stress itself can raise your pressure. Third, should you measure at the same time each day? It helps, especially if your doctor is tracking patterns. Morning readings are often a bit higher. Evening readings can be lower unless you've been active or stressed. Pick a time that works and stick with it. Fourth, what if your readings are always higher at the doctor's office? That's called white coat hypertension, and it's real. The stress of being in a medical setting can temporarily raise pressure. That's one reason home readings are so valuable. They show what's happening in your normal environment. Fifth, can anxiety about the monitor itself raise your reading? Absolutely. If you're tense and worried every time you press that button, your nervous system responds and your pressure goes up. That's why the quiet rest period before measuring is so important. And sixth, when does keeping a log make sense versus when does it become counterproductive? If your doctor has asked you to track your pressure for a week or two so they can see the pattern, write it down. Date, time, reading, and maybe a note about how you felt or what you'd been doing. But if you find yourself checking 10 times a day and getting more anxious with every reading, step back. That's not helping. Trust the process, measure correctly, and check just often enough to have useful information without turning it into a source of stress. Let's talk about what to watch for over the next week. Spend 7 days using the improved technique we've talked about. Same chair, same arm, bare skin. Cuff at heart level. Quiet room, rested body. 5 minutes of calm before you start. Take 2 or 3 readings each time and record the average. At the end of that week, compare the pattern of numbers to what you were getting with your old rushed method. Notice if the readings are more stable. Notice if there are fewer scary spikes. Notice if the numbers are starting to make more sense, if they align better with how you actually feel and what your doctor has been saying. You might find that your pressure isn't as high as you thought, or you might find that it's consistently higher than you realized, and that conversation with your doctor becomes more accurate and useful because the data you're bringing is reliable. Then, over the next 7 days, days 8 through 14, shift your focus from individual readings to the overall picture. Don't obsess over any single number. Look at the trend. Are most readings in a healthy range? Are there particular times of day or situations where pressure goes up? Are you feeling calmer about the process because you understand what affects the numbers? At your next doctor's appointment, bring a simple written log, just date, time, and reading, and have a real conversation about what those numbers mean and whether any changes in medication or lifestyle make sense. That's so much more valuable than trying to remember random readings from memory or showing up with a phone full of screenshots that don't tell a clear story. I want to talk about what all this really means. Many men over 60 feel that blood pressure is this unpredictable enemy, a random number that appears on a machine and controls their life. But it's not random. It's a vital sign, just like your pulse or your temperature, and when you measure it correctly, you can understand it, track it, and respond to it. Learning to use the monitor properly isn't nitpicking or obsessing over details. It's self-protection. It's self-respect. It's taking control of information that matters deeply to your health and your future. When you know the number on that screen is accurate, you can have real conversations with your doctor instead of guessing. You can make informed decisions about medication, diet, activity, and stress. You can stop being scared of a machine and start using it as the tool it's meant to be. So here's what I want you to do. Next time you're about to check your blood pressure, pause. Think through what we've talked about. Empty your bladder. Sit in a proper chair with your back and feet supported. Put the cuff on bare skin at heart level. Rest quietly for a few minutes. Stay still and silent while the cuff does its work. Take a second reading after a short pause. Write down both numbers. Do that consistently for the next 2 weeks and see how much more sense the numbers make. If you realize you've been making one of these common mistakes, don't feel bad. Most people do. Just fix it and move forward. If you're willing to share, drop a comment below with your age, country, and which blood pressure monitor mistake you realized you'd been making. Subscribe to this channel for more senior health tips on staying independent, informed, and in control of your health as you age. And remember, the next time you wrap that cuff around your arm, you'll know exactly how to make the number on the screen finally mean something you can trust.